Hi, I'm Dr. Lowry Barnes. I am a specialist in orthopedic surgery and I subspecialize in hip and knee replacement. And I'm also chairman of the Department of Orthopedics at UAMS. Can early intervention help decrease the need for hip or knee replacement? And certainly it can. Sometimes it's weight loss, sometimes it's muscle strengthening, and sometimes it's a more minor operation. We now have a diagnosis around the hip with a big fancy name called femoral acetabular impingement. And it simply means that the ball, next to the ball, there may be a bump there from a childhood problem, and when you rotate your hip, that bump now pushes against the socket. Now we know that small procedures can be done arthroscopically to remove that bump and hopefully alleviate the need for hip replacement in the future and certainly delay it. And there's similar things can be done about the knee. So oftentimes patients don't need a hip or knee replacement, they need the first step and hopefully the last step. How has hip or knee replacement evolved? I had this discussion yesterday. When I finished residency, our average length of stay for a hip or knee replacement at UAMS was 12 days. Our average length of stay now is 1 day. So our patients have a hip or knee replacement and go home the next day. So how can that be? What's changed? Anesthesia techniques are better, the pain management techniques are better, and we've learned. Most of our patients are well patients who have a bad hip or knee. They don't need to be in a hospital, they need to be at home in their own surroundings, getting better and getting back to life. How can an academic center like UAMS help me in what I do for patients? Well, it's a wonderful team approach. So we have residents and students working with me to provide a team approach to the care of the patient. And where there's learning, there's progress, and we want to be a part of that.